mechanics. You had a kid come in, he's 5'8", starting pitcher for us. 5'8" is not exactly what you normally associate with being a starting pitcher. Ever. So when you have a school with 250 kids, and you do what you can. 250 kids, 6 through 12. You do what you can. So he comes in complaining that he's got an impingement syndrome. And so a lot of it has to do with going through and trying to figure out what's going on. Because like she said, it's usually indicative of something else being the problem. And I don't exactly have a high-tech lab where I was. And there's certain landmarks you want to see, as we've discussed. So I kind of put tape on his arm so we can kind of get a feel for how he's throwing or where his arm position is at. So this is him. Now normally, again, once you get above 90 degrees, that's when there's a lot more humeral motion within the scapula. The scapula tracks more above 90, but that humeral head starts pinching up into that subacromial space. So if I'm having a pitcher throw, I really want this to be straight across. And even the better pitchers, when they go, if they are coming from higher up, you can still really literally take a line across the front of their chest and a line here, and you're still getting a T shape. So they're still not going way up and over. So they'll get leverage by coming here and dropping the shoulder rather than coming from here and just reaching up. Now if you watch how he's throwing though, he'll drop his shoulder some. But he gets his height by picking his elbow up significantly into where it's impinging. So it's actually, all of his impingement was stemming on his mechanics trying to pretend he's a taller guy. Because he gets more leverage by getting that height to then throw down. So we had to stop, pull him out, which is tough when you start a pitcher with 14 guys on a baseball team. And really we had to work a whole lot on just retraining him throwing from here and keeping that the humerus at 90 rather than coming up and above. So it's really, again, something I would have missed if I didn't have the ability to kind of put this on film and slow it down. But yeah, because he comes, it's like he throws and then he reaches in that second half of that stage. Which really kind of just crams that humeral head up into that space. His elbow height comes way up here by the top of his head. He's reaching way up, trying to get that going.
Yeah, and that just causes further problems in the shoulder. Let's go a little bit through so some things you want to ask for, say if an athlete comes in and saying, man, I'm having some pain in my shoulder. What's the history? What do you want to find out?
If there's any previous injuries?
Yeah, any previous injuries, that's a big one. So that's a good thing you brought that up. Previous injury so say if they've had an anterior dislocation, I know we haven't talked about that yet, but how would that factor into any rotator cuff problems or maybe even impingement? Look at it that way.
Well, ligaments were already stretched out, so there's a lot of laxative, yes. So there's like...
So maybe see if they had the surgery or not, especially if they didn't have surgery. check into their previous rehab, like what did they do, how long ago did it happen, observation. So what's a key way that I kind of look at when someone tells me that they have a shoulder injury is, for one thing, you can't find anything out if they have their shirt on, right? You can't see any deformities. So when they take their shirt off, that is like the best way you can tell whether they're in that much of pain. Let's see, like if they take the opposite sleeve off first and then take it down, you know that they're like having a limited range of motion, or if they just take it right off and they're fine. So you can learn a lot by just observation in that sense. And let's see. So what else for impingement are you going to be observing too? Like, what are you maybe seeing if they're out? Say if they're let's use baseball for an example. Do you think that if they have impingement, is their mechanics going to be different in any way than normal?
It hurt them going past lightning.
How so?
Probably start throwing.
Yeah. So they could be compensating for it, so if it's hurting them to go up here and you see them and they start throwing like down below 90, or swimming has a lot of shoulder issues, right? Yeah, so they could start maybe having their stroke a little bit different as well. Functional status, just hide into that a little bit. So physical examination findings, what do we say about that? We're talking about impingement.
Hawkins test.
The Hawkins
Yeah.
test. What about some sulfur sign for AC joint? What about any manual muscle testing?
Range of motion.
They abnormal.
How do you guys think you
Resist-
could manual muscle test the? You guys have gone over manual muscle testing
Just for lower.
briefly.
Yeah.
Okay, so how could you manual muscle test if you're looking at for the rotator cuff, if you can break it down?
Isolate it from like the deltoid, because you don't want to get the deltoid.
How would you go about doing that?
You could do like
90?
adduction.
Okay. Here, someone hop up here. Okay. All right, so some ways to, if you want to isolate to the rotator cuff only, it's kind of just going back to how we talked about with the TheraBand. So put your face me. So like have them go at 90, and then don't let me push your arms in. So right there, and then don't let me push these out. So that's internal, and then when I'm resisting her, that's external rotation. And then this is called the empty hand test, and this is strictly for the supraspinatus, and then don't let me push it down. Yeah, and with that, with the rotator cuff tear or tendonitis, maybe some impingement, they'll just completely like just drop. Like instead of hers, like she's staying strong, so. Okay, yeah, that's good. What are the 4 rotator cuff muscles?
Supraspinatus.
Yeah, first meniscus, teres, minor.
Triceps.
So scapularis.
So supraspinatus.
Teres minor.
Traps?
No.
Traps are stabilizers?
No, that's teres.
Teres minor.
Yeah, teres minor.
Sits.
And then it's
That's how it is.
subscapularis.
That's right.